Pratika, the nurse today looking after Miss Anna Berry. She has just come from her orthopedic surgery in her right tibia, which was due to her accident. So basically today I'm going to assess her wound, the drainage attached to her wound site, and redressing it after getting the swab for the culture and sensitivity. Before getting all my procedures done, I have to get consent from the patient, and I'm just letting her know that I'm going to do the wound assessment and all those procedures to her. So, hi Miss Anna, it's me Pratika, the nurse looking after you today. Is that alright? Is that alright if I would just take your blanket to assess their wound and just take the drainage system that has been attached to your wound and to get the swab from your wound for the culture and sensitivity? So Anna has said yes, and I can do it now. For the privacy of the patient, I'm just drawing the curtain around. And I've already performed my hand hygiene. So the dressing pad that I'm going to use today is to be applied with the aseptic technique. So just going to get it, I've already checked my 6th ride of the medication, 6th ride, and the expiry date of the dressing pack is 2014 January, which is good. So I'm just popping it in the dressing foam. While doing this, we can actually tilt the outer part of the pack, but not the inner part, just to maintain the aseptic area around the dressing thing. So I haven't tilted the inner part of it. Just getting the things out of it and just really organizing it. I've got the normal line, and this is the dressing that we're going to reapply in her wound again, and it's got expiry date of 2013, which is good. I'm just putting it in the tail area as well. And the non-adherent dressing, which will be attached to her wound, and the expiry date is 2014 February, which is okay. And just getting it popped into the tail area as well. And this is the swab for the culture, getting the swab from the wound for the culture and sensitivity. Should be in the tail area as well, so I haven't really touched it yet. Just going over here. And after this, we have got the normal slime to clean the wound. I'm just pouring it into the container, which is in our tail area. So I've already poured down the normal slime into the container, and I've got all my sterile things ready here. And I'm just going to put the normal gloves on to get the dressing out of her wound, and just assessing the wound and cleaning the wound just to make sure that there is no any exudates from the past dressing. There is no any dried necrotic tissues around, and the normal gloves, and I'm just putting it in. Hi Anna, I'm just putting your blanket down just to assess your wound and your wound drainage site. So Anna said yes, just put it down. As we know, before getting the swab, we're just going to assess her wound and the wound drainage attached to her wound. And I'm just getting the previous dressing out of it. And the dressing before. And so in here, I've already taken her previous dressing out. Now I'm going to put the sterile gloves on, which is here. Before putting the sterile gloves on, I've already washed my hand again. My dominant hand is this on these gloves first, and I'm just not touching outer part of the glove, just touching the inner part. And just do the same with this one. I can actually toss the outer part of it because this hand is already sterile. I've got my sterile gloves on, so I can toss the sterile part of it here now. I've already put the normal line. Now I'm going to get some swab into the normal line just to clean the wound. So I'm just going to clean the wound to make sure that there is no any past residue from the past dressing. There's no slough or any necrotic dead tissues around. It's just going around the area from inside of the wound towards the outside. So this is the actual place where the drain is passed. So I'll just clean it. And now here. Been cleaned again. That has been cleaned, so I'm not gonna use it again because it has already topped the wound. So I have already cleaned the wound, and I'm just getting the swab from the wound. Moving the swab in a zigzag motion, in a circular motion, so that I can get much of the wound area. Immediately after I get the swab, I'm just putting it in the container, just to prevent any infection. I'm just going to throw this on, so it's clean now. And after this, I'm just going to look at her drain side. It has been attached properly. There's no kink or any cord around the drainage, and there is around 100 ml of drain. It looks normal, and while assessing the drain side and the drainage, we are looking around the amount of the drain that is in the container, that is in the drainage system, and the color. So it looks good here. Just touching it again. And now we should also actually assess the wound, and the area around the wound looks good. And while assessing the wound, we have to assess the tenderness, the pain, if there is any pain around her wound area, and if there is any abnormal appearance, and size of the wound, the depth of the wound. So that's all about the wound assessment. So there is no any other abnormalities. Now I'm just gonna redress it again. So this is the clean dressing I've got. Pretend that I've already cut it in a U-shaped tube so that I can pop it into the attached drain. And now I've got the combined. Let's put it here. And I've got the sticky tape. Just taping it around. So I've applied the new dressing and taped it. Just covering the patient to make sure she's warm. Now I'm just getting this the swab into a container with the MSN number check, date of birth of the patient, the right name, the specimen, the hospital name, the ward name, and the address of the hospital. So as long as information we can give it in here, that would be easier for the pathologist to go through what's happening. And this is the pathology order that I'm going to send it with. And so it's ready to go to the pathology. And I'm just throwing the contaminated waste into the dirty bag. taking my gloves off. So after all the dressing is done, and the drain system has been checked and already got the swab for the culture and sensitivity, we should really document it in the progress note of the patient, and we should also document the actual amount of the drainage that is in the drain system in the fluid chart. So after all of these, finally, if there is any abnormalities in the drainage system, or if there is any faulty smell around the wound or around the drainage system, we should actually call the doctor and let him know what's happening with the patient. So that's all about it. Thank you.